Senator Lyons.
Thank you, Mr Acting Deputy President. And I too rise to take note of answers given by Assistant Minister for Health, Senator Nash, to questions from Labor senators today. Before I do that, I think someone ought to inform Senator Bernardi that there's not a kind of one speech fits all, because we just heard today from him the usual rhetoric that you would expect from Senator Bernardi. But one of the things he did do, he did actually confirm that the government has indeed cut the health budget, because he was at great pains to point out about how the government needs to be fiscally responsible. He went further than Senator Nash did, and I asked her specifically about comments that the Australian Medical Association had made, a very conservative body, but nevertheless a body that is concerned about the health of Australians. And I think when the Australian Medical Association starts to complain about cuts to the public health system, then we should really listen. And certainly since almost the term of the Turnbull Abbott government, the AMA have been very concerned about significant cuts to spending in the public health area. And you only have to look at my state of Western Australia, which is in a disgraceful state. The Fiona Stanley Hospital, a public hospital that the Barnett government has privatised, 18 months late in opening and cost millions and millions in budget overspend, and the same now for the Children's Hospital. Certainly the Barnett government has demonstrated, a Liberal government, that it cannot manage anything at all, and it particularly can't manage public health. Our credit rating again in Western Australia has been reduced 2 or 3 times under the Barnett government. But the other group that Senator Nash referred to today was the National Aboriginal Community Controlled Health Organisation, who actually I've recalled Senator Nash saying before that she's got very good relationships with. Well, she might have good relationships with them, but they have well and truly documented and spoken out at length the cuts that we've seen to Aboriginal and Torres Strait Islander health programs right across the nation. Cuts that NACCHO believes will go to the very provision of essential services in rural, regional and remote Australians. Now, Senator Nash is actually a National Party senator, purportedly representing the bush, but it is a long time since the National Party in Australia has represented anyone's interests other than their own. And certainly NACCHO, like the Australian Medical Association, a credible organisation, really putting down on the public record exactly where those cuts have taken place. So we've seen cuts for NACCHO in the area of Aboriginal and Torres Strait Islander health, in communicable diseases, in substance use treatment services, and in drug and alcohol services. There are just 5 specialised Indigenous programs left. And we've seen just a week or so ago the absolute shameful death, a young 10-year-old girl taking her life in the Kimberley, and we certainly don't need to be looking at cuts to community organisations, particularly in the area of health, that go to the level of suicides, which now in the Kimberley are the worst in the world, for Aboriginal and Torres Strait Islander people. The highest rate of death for young Aboriginal people now is suicide, and what a shameful record. So we don't need to see cuts to health, cuts to program, cuts particularly to preventative programs that go to closing the gap. We've seen, and this was one of the cuts that came out for Aboriginal and Torres Strait Islanders in that woeful, shameful Abbott government first budget, the one that Mr Turnbull has signed up to, for the Indigenous smoking program. We've got very high rates of smoking amongst Aboriginal and Torres Strait Islander peoples, but of course what's happened, we've just seen that program slashed and burnt. When these are the issues, we know that to improve Aboriginal and Torres Strait Islander health, we need to put Aboriginal people in charge of these programs. Aboriginal and Torres Strait Islander-led solutions put in place by Aboriginal and Torres Strait Islander people. Not white fella solutions, but actual solutions led by local people and local communities. And smoking was one area where we were seeing some success, but that program's been cut. So nothing but weasel words from the government today. They have cut spending in health.
Thank you.